So welcome everybody to today's webinar. I know people are joining from really all over the world, so a big welcome wherever you are. We're very pleased to have you with us. My name's Kay Julia. I'm the Managing Director of Ehlers-Danlos Support UK. I'm just going to start with some housekeeping, just to let everyone know how we're going to run the session, and then I'll introduce Jeannie and hand over to her. So everybody's on mute. That's to give us the best sound quality for everybody. If you can use the chat, that will be great, and I'll be monitoring the chat to pick up any questions. There will be hopefully time at the end. Jeannie's going to speak for about 40 minutes, and then she'll be taking questions. So I'll pick those up from the chat, and Jeannie will be able to see the chat as well when she's finished. I suggest that you have your screen set to speaker, so your view set to speaker. That means you'll only see the person who's speaking and the slides. We are recording the session, but nobody will be visible. It will only be mine and Jeannie's screens and the slides. And I understand there's some concern about the time that has been published via Zoom, but don't worry, because the recorded session will be sent to everybody who's registered, so people can always go back over it if they've missed something. If for any reason your Wi-Fi drops and your device kicks you out, don't worry, just ask to rejoin and we can link you back into the session. And as I said, because it's been recorded, you'll be able to go back over anything that you've missed. So without any further ado, I'm very pleased to welcome Jeannie Debon and thank her very much for giving up her time today. Coming to the end of EDS Awareness Month in May. So Jeannie, for those of you who don't know, is a movement therapist. She specialises in hypermobility, Ehlers-Danlos syndromes and chronic pain. She has over a decade of experience in supporting clients with their pain management and guiding them on their journey to health and well-being. She's the author of 2 books, and she writes for the Huffington Post, The Mighty and Thrive Global on a range of topics around chronic illness and invisible disabilities. So Jeannie, thank you very much for joining us today, and I'm going to hand over to you.
Thank you. Can you hear me okay? Is that okay? Yeah. Thank you so much, Kay, for introducing me, and thank you everyone for joining us today. I'm really excited to be here. Really excited and I just want to thank EDS UK for awarding me the Community Champion Award earlier this year as well, which is an absolute honour. So I'm delighted to be here to talk to you about hypermobile backs. So yeah, let's get started. Let me just minimise this. Okay, so hopefully you can all see my screen, and we're here to talk about a pain in the hypermobile back. And I hope this always happens, just bear with me. There we go. Okay, so just the objectives of today. So we're going to be hopefully gaining some knowledge about what could be causing pain. We might have some tools to help you recognize your pain triggers and some techniques to help you manage your pain. Hopefully I'm going to give you a little bit of confidence in your ability to move without pain. And as Kay says, I have been working for over 10 years in the EDS HSD community. I see people one-to-one, in person or on Zoom, so I have clients all over the world. And many of you may know about the Zebra Club, where obviously we have clients or members from all over the world. And I'm hopefully going to give you some ideas, some solutions, some things you can do at home to help manage your back pain. Okay, so we've already had an introduction, just a little bit more here. So yes, as you know, I speak for speaking today for EDS UK, but I also speak for the UDS Society. And as I mentioned, I was awarded the Community Champion Award by EDS UK in January this year. I also educate teachers and therapists, so physiotherapists and physical therapists on hypermobility and EDS. And some of you may have taken part in the research project that we had back in 2019, 2018 on Strengthen Your Hypermobile Core, which has been the subject of a research project between UCL in the UK and Clarkson University in the United States. And that really has some promising data about the impact of movement therapy for pain for our community. So, pain facts. Chronic pain, and honestly, the number one reason people come to see me is because of chronic pain due to their hypermobility issues. So it's extremely common in our community. EDS Awareness did a survey back in 2016, and 70% of people reported that their chronic pain started before they were 20. So that's a long time to be in pain. There are many different types of pain. So as you guys probably know, pain is a very complicated topic. You know, I certainly am not going to say I have all the answers today. I don't. So my talk is very much based around my experience over the past 14 years and my own personal experience as well, because I also have HEDS. As well as many of you. So pain is a very, very complicated and multidimensional issue. So you can have the nociceptive pain, which is obviously the pain you get when you have a damage to your tissues, neuropathic or nerve pain, inflammatory pain, visceral pain, dysfunctional pain, and things like migraines. So all of these things, you can have all of those all at the same time. So it can be really, really complex. Many people decide or you know, feel that they're not able to exercise due to pain, fear of movement, instability, or being given inappropriate exercises. And this was some research from Dr. Leslie Russick, who's a physical therapist in the US in 2019. We also know, and the more I work with this community, the more I learn about this, is the nervous system, and that the interactions of our nervous systems in how we perceive movement and how we move. And many of us go on to develop what we call sensitization. So the body becomes very, very sensitive to movement and can cause pain, even though there's no damage there. So we're dealing with that level as well, at the nervous system level. Low back pain is thought to affect around 70% of people in industrialized countries. That was from research back in 2007. So that's 70% of people. That doesn't mean 70% of EDS HSD people. I would imagine it's probably a little bit higher in our community. And Dr. Hakim, I think this is from his book, neuropathic pain, so that nerve pain, accounts for at least 1/3 of acute and chronic low back pain. So that's huge, isn't it? 1/3 is neuropathic pain. And that's probably the trickiest one to deal with. Okay, so what pathologies could there be? And this is quite reassuring in many ways. So if you look at the top here, we've got herniated discs, compression fractures, spinal stenosis, cancer, all these different things. Again, this is from Dr. Hakim's book. I hope you can see my camera. Hypermobility, Fibromyalgia and Chronic Pain. It's a fantastic book. It's written for practitioners. So if there's any practitioners listening, you might want to get a copy of that book. It's really, really good. But if you don't mind a bit of a technical read, I recommend that book. So he says in his book that these sort of pathologies, you can see the percentages, they're very, very small. So, you know, spinal infections, 0.1%, stenosis, 3%. So specific causes for low back pain are uncommon and account for less than 15% of all conditions. So in a good sense, it's not like you've got something like this going on. The numbers are very, very small. That's not saying you haven't, I'm just saying this is from his research. Okay, so in one sense, that's quite reassuring that there's nothing sort of more sort of serious like a herniated disc or a stenosis or you know, cancer or something like that. But on the other side, we've probably all been in that position where we've gone for scans and MRIs and they've come back and said, well, there's nothing wrong. You know, your scans are perfectly normal. And we're like, well, what's causing our pain then? I'm in a lot of pain, and yet my MRI comes back saying there's nothing wrong. So I really wanted to investigate in this webinar, what's causing our pain if no pathology like the ones above are found. So Of course, there might be other conditions going on, and you might have some of these. So scoliosis, which is a curvature of the spine, arthritis, osteoporosis. Okay, these are all sort of more common things that you might have heard of. You certainly might have fibromyalgia. Now, we know, of course, that many people with fibromyalgia end up sort of maybe being misdiagnosed. They actually have EDS or HSD. SI joint dysfunction, I see a lot of that, a lot of SI joint pain. Degenerative, that's always a tricky word to say, degenerative disc disease. Okay, facet joint issues, sciatic nerve compression, pelvic girdle pain, pelvic floor pain, labral tears and impingements, and overpronated feet. Even our feet, which we're going to look at later, can be a cause of our pain. Okay, so as you can see, there's many reasons that are going into the mixing pot that might be the cause of our pain, on top of having EDS and HSD and everything that goes with it. Okay, so just have a little, and you can sort of raise your hand or just, you know, give me a little wave. Yeah, how many people have seen a physiotherapist or some sort of medical professional for back or pelvic pain? Yeah, so all that, yeah, the numbers are going, oh, look at this. The numbers are shooting up here. I'm just going to wait and see how high we get on that question. Yeah, so 60. So yeah, goodness, really big. So many of you have seen a physiotherapist or some sort of health professional, rheumatologist for back or pelvic pain. So that's a huge number, isn't it, of our participants. And as I said earlier, pain is a huge topic. Today, we're just looking at low back and pelvic pain. So as opposed to other sorts of pain. And as I said, I certainly won't have all the answers, but I will do my very best to answer any questions you may have, or, you know, give you some resources if I don't have the answers. Okay, thank you for that. Thank you for answering that question. So if there's no pathology found, you know, the MRI comes back and it's all okay, what could it be? So we're going to go into these in more detail, but we have things like biomechanical. So that's our ligament instability, which obviously is a huge part of our condition, alignment, which we're going to talk about, postural issues, which we're going to talk about, and environmental. So that is, what kind of stressful situations are you in? Are you, you know, do you have a stressful job? Do you have a stressful home life? That sort of thing. What's your environment like? We have our musculoskeletal issues, so deconditioning. So we do know that people with our condition do decondition quicker than people without our condition. And deconditioning, that's basically means when we start to lose our muscle tone, so the muscles aren't as strong and supportive as they could be, that's going to cause pain. Our tissue is quite irritable. You know, we don't like repetitive movements. We don't like over, you know, doing lots and lots of reps of the same exercise. It can get quite irritable. Stress can make the tissue quite irritable. So many things go into that irritability. We can suffer from spasms. I'm sure there's many of us here who have spasms. Yeah, and they just happen. And strain, obviously musculoskeletal sprains and injuries should probably be in there as well. Nerve impingements and compression can be quite common, because obviously if we have a sort of a poor posture, deconditioning, we might start to hang in our joints, we might start to compress those nerves. Yeah, so lots of people are raising their hand there as well. Thank you. And then you get this sort of chronic generalized pain. It could be all over the body. And again, nobody is able to pinpoint where that's coming from. And, you know, that can be quite stressful just in itself, isn't it? If you have pain and nobody can tell you where it's coming from, it's stressful. As we mentioned earlier, stress and anxiety, that can cause pain. If I'm stressed and anxious, chances are I'm going to start kind of tensing my muscles, maybe go into a protective mode. And if I start doing that, and to be honest, I did this for, you know, for the first sort of 30 years of my life, or probably longer, holding ourselves in a certain way is going to cause pain. It's going to cause tension in those tissues, and tissues that are tense are going to start hurting. Trauma and mast cells. So obviously many of us might have mast cell activation syndrome. They can cause pain as well. And we talked about the environment, our environment, whether we have a supportive environment. There's been research into this, that, you know, people who have more supportive environments, their pain tends to go down. So we have to take into account this sort of what we call a biopsychosocial element to our pain as well. Okay, so just some low back pain facts. Some research done from Harvard Medical School in 2016, 8 out of 10 people, which is really big, will have back pain at some point in their lives. That's huge, isn't it? That's really quite a chronic condition. So I think we've established that many of us here today have had back pain at some point in our lives. You may have it today. You may be watching today because you are struggling with back pain. So what can we do now to manage to improve our functionality and our quality of life? Because let's face it, when you're in pain, our quality of life does get impacted, doesn't it? You want to do less, you don't want to move around as much. Maybe you know, start to not go out as much, not see friends and family as much. Some people obviously have their work impacted. It can really affect us. So is there anything we can do to help change that and improve that? So what are we talking about here? We're talking about, let's talk about the structure. What kind of structure are we dealing with? So we're obviously talking about the spine. If we're talking about back pain, we're talking about, first of all, we're going to look at the spine. So what is the spine? Well, it's your body's central support system. Okay, and it connects different parts of the musculoskeletal system, and it is all connected. Yeah, you know, if you look at a body, we're not just individual muscles, even though it looks like that in the anatomy books. In real life, everything is connected. All the muscles are blending into each other. They're all connected. So you could almost say you're one big muscle that's kind of divided into little bits, and they all do their own different job. Now, a healthy spine has 3 natural curves designed to absorb shocks and prevent injury. So the big job of the spine is actually as a shock absorber. So when we walk or when we run, it's absorbing the impact every time you hit the ground. Okay, and it's made up of 33 vertebrae, and they allow for all the different ranges of motion. And some of the vertebrae do more ranges of motion than others. So they all kind of have their own job. Now, the sacrum, we talked about people having SI joint issues. So that's your sacrum, yeah? And the joint where it's attaching to the ilium, yeah, the SI joint. Now, the sacrum and the coccyx, which is your tailbone, they're fused together. Okay, so in theory, they're not coming apart. Facet joints, so those are the bits that stick out on the side, they control direction of movement between the vertebra. And then we've got discs, so these are the discs in between those vertebrae, and they're like little cushions of gel, which again are designed to act as shock absorbers. Now, our ligaments are designed to limit vertebral motion. Okay, now if we have ligament laxity, you can imagine what that means. If we're lax in the ligaments, the vertebra might be moving more in some areas than others. They might be moving more than they're supposed to. Okay, and the muscles control the vertebral motion as well, so the movement of the vertebra. So if we have deconditioning in our muscles, yeah, or maybe we've been immobilized, maybe we've been, you know, some of us may have been bedbound or unable to be as mobile and as active as we would like. Those muscles are going to get deconditioned. They're not going to be doing the job of controlling the vertebral motion either. So we've got kind of a double whammy there, the ligament laxity and maybe the deconditioned muscles at the same time. So here's our lovely spine here. This is a perfect looking spine. Okay, nobody has a perfect spine. Nobody has perfect alignment. But the closer we can get to good alignment, the happier the body is going to be. So we're talking today obviously about lower back. So we're talking lumbar spine. And you can see there, that's right at the bottom. You've got your coccyx at the bottom, your sacrum, and then your lumbar spine. And that's got 5 of those vertebrae that we were talking about, okay? And it should have this lordotic curve. So it has this little curve that bends, I guess you would say, backwards, yeah? And it matches the cervical's curve, which is the one of your neck, okay? And then the thoracic curve is supposed to go the other way. That often kind of changes shape, right? Some people get a very flat lumbar spine and it hasn't got the curves. The spine loses those curves. And of course, remember, the spine is a shock absorber. So if we start to lose the curves, are we losing some of our shock absorption, coupled with the ligament laxity and maybe the deconditioning of those muscles? And it says there, the lumbar spine bears most of the body weight. So if you think about it, when you're sitting, we're probably all sitting now, all of our weight is going onto that lower back. And I think that's why people find sitting so painful a lot of the time, because we're kind of crushing down onto that part of our spine. Especially if we're kind of lacking that muscular control. So we might start to slouch, we might start to sit down and sort of crush that area a little bit more, okay? So that's what our spine should be looking like. And this is just obviously a full body skeleton, which I look at this and I just think, gosh, this is amazing. Because if you look at the alignment, as I say, this is nobody has a perfect alignment like this. I've never met anyone in all my years who has a perfect alignment. But if you just look at it, I like looking at the one in the middle, the side view. Can you see how everything is perfectly aligned? So from the back of the head, you could pretty much draw a line from the back of the head to the back of the rib cage, to the back of the sacrum, to the heel bone. Can you see it's pretty much perfectly balanced? Yeah. If you look at even the guy facing or looking away, you can see how that is perfectly balanced. The shoulders, I mean, nobody's got shoulders like that, right? Most of us tend to have one shoulder higher than the other. That's just life, where nobody's perfect. Yeah, people raising their hands that I know I don't have perfect shoulders, because life, we're left or right handed, we're going to do things in a certain way, you're going to develop more muscle, more tension on one side of the body. Okay, so, but if you look at it, you can see how beautifully balanced it is. And if everything was in that place, I think we would have less pain, maybe. Okay, it would certainly help. Yeah, so alignment, in my opinion, alignment really, really matters. And I have a picture like this in my studio behind me, because I always like to show my clients where the bones should be, yeah, where our spine should be, where the pelvis should be, yeah, where our feet should be, because it really helps us understand where we should be in space. So I think it's really, really important. So here I am. What happens then if I'm supposed to look like that from the side with this beautiful alignment? What happens if I stand like the person on the left? So here I am, I've locked my knees. I've got a large lordotic curve. Do you remember the spine was supposed to have 3 lovely gentle curves? Well, here you can see I've got a very big lordotic curve. Okay, my shoulders, my ribs have been pushed backwards, and typically because of that, my head will have to come forward. So the pelvis typically mimics the head, or the head mimics the pelvis. So if my pelvis goes forward, my head is typically going to come forward with it. Okay, so apart from locking my knees, which obviously isn't great, when you lock your knees, the pelvis instantly will go into an anterior tilt. So it will tip forward. And when it tips forward, you'll be left with this big curve in your back. Now, can you imagine what the muscles in my lower back in that area feel like when I stand like this? So you remember the spine is supposed to have this lovely gentle curve. Here I've really exaggerated it. And those muscles just above my pelvis are now getting quite squashed and tight. So they're going to be grumbling a little bit. The muscles at the front are getting stretched. Yeah, my viscera, my organs are being pushed forward, not very good for any kind of visceral pain. And my shoulders are obviously in the wrong place now. So it's going to cause a bit of issues with shoulder, maybe thoracic pain as well. Okay, so that's that one. If we just go back, so there's our perfect study again. I don't look like that. And then if we look at the picture on the right, so this is more of a sort of a hanging, slumping posture. So in this posture, more of my weight's in my back. I'm kind of hanging back, slouching a little bit, shoulders definitely rolling forward head posture. I almost get a sense that I'm being dragged down at the front of my body, not much activity going on in my legs at all. So I might not have locked my knees, but there's not a lot else going on. I'm kind of just hanging there. And before I started working in this field, that's what a physiotherapist told me. He said, you're literally hanging off your joints. You have no stability. You need to go and do some kind of Pilates type exercise. But of course, back then, this was a long time ago. This was in 2006. I didn't know what he was talking about. I didn't know what stability was. I just had zero body awareness. So I would just hang around like this most of the time. And I was in a lot of pain, really a lot of pain. So neither of those look particularly like how they're supposed to look, right? And I see both of these postures quite a lot with my clients. So I call them sort of typical hypermobile postures. Okay, and you can vary, of course, between one and the other, depending on how you're feeling. Okay, now this is an interesting one. So this is, I think this comes from my colleague, Gary Ward, who's a biomechanical foot expert. He's the author of What the Foot. And we did a podcast together on my podcast on YouTube where we talk all about hypermobile feet if you're interested. But here, I said earlier that pronated feet could be the cause of our pain. So on the right-hand side of your screen, you've got aligned feet. So the green line, you can see how having your feet in the right place helps keep all those other bones in the right place. So this guy has a pretty good posture. But what happens if you have misaligned feet? So here we've got a rolled in foot. So the arch has dropped. That's our sort of flat feet over pronated foot. That causes our knees to internally rotate and it causes the pelvis to tilt. And this guy's dropped on one side. So again, his spine is now having to twist a little bit. And you can see the red line. It has to kind of swerve because your brain will always want your head to be vertical, right? In a straight line. You wouldn't walk around with your head tilted to the side like this. So the body will adjust and do its very best to make sure you can see ahead straight. But in order to do that, your spine has had to twist and turn a little bit to get you in that position. So again, this guy could be having pelvic pain, could be having that hip pain on the right hip there, could be having low back pain, so thoracic pain, neck pain. He could be having all sorts of pain. And many of us, of course, do have the overpronated feet. It's quite a common thing for us. It doesn't mean you can't change it, of course. You can change that. So very interesting to look at that. Looking at the structure. So lots and lots going on, isn't there? So here we go. There's half a skeleton and half of what your muscles look like on top of your skeleton. You can see there's a lot going on. So around that lower back, you have layers of different muscle. But what's interesting, can you see how the muscles are feeding from above? So they're coming down from the shoulder, down into the lumbar spine. But you've also got muscles feeding up into the lumbar spine. So we've got to really think of this balance between above and below the pelvis. Okay. And then this is a picture of your, or not your pelvis, but it's a picture of a pelvis. And I've called it pelvic density because I just wanted to show you, I find these really interesting and I think it helps people understand their bodies a little bit better. You know, look how many muscles, so many of us might have pelvic pain, yeah, or pelvic girdle pain. look how many muscles are involved in your pelvis. And look how they lay on top of each other and wrap around each other. It's a very, very dense area. I think there's something like 30 something muscles that attach to your pelvis. Okay, so that's a lot, isn't it, to kind of get balance with. Now, one of the things I talk a lot about to my clients and in the Zebra Club is having pelvic balance. Okay, and we're going to talk about balance in a little while. But if so you see you've got your psoas muscle here on the left-hand side of the screen, big, thick muscle, that's a hip flexor, but it attaches up into your lumbar spine. Can you see it comes all the way up into the vertebra there? But it's also a hip flexor. Now, if that guy, just an example, if he gets really tight, he has the ability to pull your pelvis forward and cause that big lordotic curve in your spine. And then we get those tight hip flexors, which we might start feeling like a hip impingement. So that's just one example. If somebody at the front gets really, really tight, so the psoas, because that's just, quite a typical one, that can have the ability to totally imbalance the pelvis. Now, if we look at our glutes on the back, if my glutes are not functioning, and many of us tend to have weaker posterior chain muscles. So the glutes, hamstrings, back muscles, they tend to be weaker. Yeah, lots of people raising their hands there. So yeah, and the front body tends to be more dominant. So the quads, the muscles at the front of your thighs, even pelvic floor, having a hypertonic pelvic floor is quite common. Bracing a lot. How many of us would say we brace? And by I don't mean brace, I mean guarding, fixing, protecting ourselves. Yeah, let's see what those numbers are like. Yeah, so a lot, yeah, big numbers. Yeah, wow, lots of numbers. The numbers going up. Thank you for sharing that. I certainly did. I was a big bracer, hypertonic pelvic floor, overactive abdominals, not able to breathe properly. So I didn't do proper diaphragmatic breathing. And I was in a lot of pain because my pelvis was out of balance. So if my glutes aren't working, you see how big the glutes are there. And of course, you've got other glutes. That's your glute maximus. You've got other glutes underneath there. If those aren't supporting the pelvis, yeah, you can see how there's going to be a big imbalance there. And weak glutes, are really important for having stronger glutes, apologies, are really important for walking and standing. So if I'm hanging, do you remember the picture of me hanging? My glutes weren't working. No way my glutes were working. So I'm just hanging off my joints. My muscles weren't working. So they're never going to help me get functional. Okay, so a lot of what I do is teach people to unwind the pelvis so that all of these muscles can actually glide and slide across each other rather than one group being very, very tight and the other group being a little bit lax. Okay, so it is a lot to do with that balance in the muscular tone. And then I know we're not talking about upper back, but I thought, we can't ignore it if we're talking about back pain, because again, you can see all these muscles that run down. You've got your trapezius muscles, which are those ones that come across your shoulders and typically are really, really painful for many of us, but they come all the way down to your mid back. Okay, there's again a lot of density, a lot of layers. You can see all the muscles listed here on the right-hand side. Any tightness or weakness up there, and this is part of your posterior chain, is going to impact your lower back. It's inevitable because everything runs into everything else. So again, thinking about the whole body and trying to get balance through the whole system is going to be really important. And I've shown this one before in my neck webinar, but again, I love this picture because it really shows us how those forward head postures put pressure on the rest of the structure. So here, the guy on the left, our head weighs about 12 pounds, perfectly balanced. His spine is in that lovely curve. Everyone's happy. As soon as we start to allow the head to come forward, the weight of the head triples. It doesn't triple, but pretty much triples. And then it gets heavier still. And if you can imagine, so if we look at picture 3 at 42 pounds, that's a lot. 42 pounds sort of hanging off your upper back. And we wonder why we get neck pain and headaches. But that is going to be pulling, isn't it? It's all the way down into that lower back, because according to my brain, in this posture with my head forward, my brain thinks my head's about to fall off. Yeah, that's the message subconsciously going to my brain. So it's going to do whatever it can to tighten up and make sure my head does not fall off. Okay. Remember, your brain is designed to help you survive. The brain is brilliant. It will adapt, and it will adapt your movements. You know, we've probably all done it. If we've had an injury, we adapt our movements quite quickly to avoid putting pressure on that sore area. If you've hurt your knee, or you've hurt your foot, or you subluxed something, an ankle, your brain will adapt your movements quite quickly, because its main function is to make sure you survive. It doesn't mean its function is not necessarily to make you comfortable, it's to make you survive. So it will tighten up all those muscles to make sure that your head doesn't fall forward anymore. So it's a very intelligent system we're dealing with, okay? Okay, so let's get on. So we've looked at some diagrams and we've looked at some alignments. Let's talk about possible causes then. So we've kind of started to get an idea of how important alignment is and balance through the muscles. So what else have we got going on? So laxity of joints. So if we have hypermobility, we're going to have laxity of joints. And what does that mean? That means that the connective tissue here around the joint is not holding and supporting the joint as well as it could be. Now that goes hand in hand with gravity, because if you've got laxity in your joints, it means gravity can pull on those bones and those joints, and it can make them hang and it can make them lax. So do you ever feel like your shoulders are kind of hanging and you feel like your arms are hanging out of their sockets? Yes, people raising their hands there, because literally gravity, because of that laxity around the shoulder capsule, gravity is pulling on those joints. So we get this sort of, oh, feels really heavy. Yeah, because that's the effect of gravity. So if that's happening, if you think of my posture when I was sort of in that hanging posture, gravity is really dragging on me. And if that's dragging on my joints, they're going to start hurting, because what's going to happen is the muscles around the joints are going to start tightening up to prevent damage. So they're going to start spasming and tightening up, saying, oh my goodness, what's happening? And gravity is pulling on them. So we've got this fight going on all the time. So gravity is playing a huge part on that laxity of our joints and can cause pain. We talked about this earlier, environment. So, you know, job, am I happy at work? Am I happy at home? Have I got a lot of stress at the moment? You know, we've all just lived through a very stressful couple of years. You know, it will have taken its toll physically as well as mentally on many of us. So that will be impacting our pain. We can't ignore that side of things. Spinal instability. So we talked about this earlier, the fact that the job of the ligaments and the muscles in the spine, are the ligaments doing their work? Are the muscles doing their work to help stabilize the spine? And you can see what happens from my photographs when I'm not stabilizing my spine. I'll either collapse backwards or I'll hang forward. Okay, that's over time. It might not hurt today, but year after year, these things can build up and you might suddenly wake up and go, oh, my back hurts. Yeah, but you haven't done anything. It's not that it suddenly wakes up one day and says, oh, let's just start hurting. It builds up. Yeah, the irritability builds up and then it says, right, I've had enough, have some pain. I don't like this anymore. Okay. Immobility in other areas. So the thorax or the rib cage and your hips. So I'm very stiff in my hips. Yeah, my hips are really stiff. My lumbar spine is very mobile, as is my neck. My rib cage is quite stiff. So if you've got stiff areas, what's going to happen is the areas above and below the stiff areas will start to move more. Okay, so if my rib cage is very fixed, and we talked about bracing and guarding and not breathing properly. So if I've got a very tight thorax that doesn't move as it should, my neck will start to get very mobile and my lumbar spine will start to get very mobile. And that means, remember, the spine is a shock absorber. The forces are not being distributed evenly through your spine. So you've got more force going through your lower back, you've got more force going through your neck, your thorax is just getting tighter and tighter. So that's a big cause of pain. Connective tissue quality. So the lumbar fascia. So in our lower back, I talk a lot about fascia, which is our biggest sensory organ. But in your lower back, you have something called lumbar fascia. Now that is really, really thick fascia. It's, you know, it's kind of like a yoga strap, that kind of thick, dense tissue. It's more glued, so it doesn't move as much. But because it's so densely full of nerve endings, when it gets irritated, it hurts a lot. So that's, so sometimes we sort of complain of that pain that kind of goes across the top of the pelvis. Yeah, we can't really pinpoint it, but it just feels really tight on the back of the pelvis. That could be our lumbar fascia getting a little bit sticky and a little bit glued down, okay? And tissue quality, of course, comes down to that deconditioning as well. How toned is my muscle? What's my postural tone like? Okay. We talked about this bit, balance between the front tone and the back tone. So if I'm very tight in my front body, my back body isn't going to be working as well as it should. So some muscles are getting longer and stringier and other muscles are getting tighter. And neither of them are going to be happy because they both want to work together. Proprioception and motor control, huge impact. Yeah, if I'm not aware of what I'm doing, if I don't know that I lock my knees and the locking of my knees causes my pelvis to tilt forward, I don't know I'm doing it. So I'll keep doing it and I'll keep having back pain or knee pain. Okay, so being aware of what we do and having control, so motor control, can I control my limbs moving in space? They're going to help reduce our pain. And I see that a lot when I teach people motor control and more body awareness, their pain does start to go down because they stop doing big ranges of motion that are potentially not controllable. Balance, we talked about it, physical, but also emotional. So yeah, that stress, that anxiety, that will actually change the quality of our tissue. So if we're stressed, the tissue will change. I was attending the Fascia Symposium last week, and there's some interesting research, not on hypermobility, but just on the quality of tissue. They did a study of patients who were suffering from depression, so an emotional state, and they found that people who were depressed had less tissue elasticity than people who weren't depressed. So that really confirms that our emotional state will have an impact on our tissue state. Okay, and that might be a postural thing because when we're maybe sad or depressed or anxious, we kind of change posture and we hold ourselves differently. I don't know the reasons, but it just was an interesting piece of research. Breathing, really important. Diaphragmatic breathing can help with lumbar stabilization. So if we're breathing maybe shallowly or up in our thorax, that can potentially destabilize the lower back. But learning to breathe and getting proper movement of the abdominal wall can help with stabilization. Relaxation, very important. It's, as you know, the second principle in my movement for hypermobility. There's an author called Gifford who's written a lot on pain management, and they found that there is a marked correlation between pain and anxiety. So learning relaxation techniques can help reduce the pain signals. And sleep quality. It has been, if we have poor sleep quality, it can be found to increase our pain. Okay, so coming back to motor control, because this is obviously a big one for us with hypermobility. So when we have poor movement control, it can set off a chain reaction. So a problem in one joint, so maybe I have poor control of my shoulder, Yeah, I can do big movements and the shoulder isn't stable at all. One problem in my shoulder could lead to widespread pain elsewhere, because the body will take the path of least resistance. So it'll move this a lot, but it might start irritating and annoying things in other areas, maybe in my arm, in my elbow, maybe all the way down that side of my body. Yeah, so we'll just go to the easiest movement because we can, okay? And that can lead to overuse and irritation of the tissues. Some of us, a bit like my photograph, tend to rest at end of range. So we hang, okay? So when you're hanging in your joints and you lock your joints, your muscles don't have to work anymore because you're literally hanging off your joints, okay? And of course, that's going to put wear and tear. If I'm hanging into my lower back, that's going to really put wear and tear in my lower back, okay? So we want to learn, be more aware of how to hold ourselves so that we do less hanging. Difficult to stay in good posture for any length of time. Yeah, many of us have this, right? We get fatigued because holding a good posture can be tiring. But I always remind people that we've got to treat posture as almost like another exercise. As I say at the bottom, posture can't be taught, because I could teach you now intellectually how to stand up properly, because we know what a good posture looks like, but you wouldn't be able to maintain it because you'd be fixing it again. Yeah, you'd be drawing your shoulders down and pulling your tummy in and all of those things. Okay, but that's not sustainable. We have to learn to, we have to teach our body how to sustain these positions, okay? And that takes training, okay? And it takes time, okay? And the weakening of surrounding tissues from disuse, excuse me. So again, from Dr. Hakim's book, if we start to have that weakening, because we're not using our tissues, that's going to impact our motor control. Okay, so it's not that we can't achieve good posture, we absolutely can, but you really need to have it in your nervous system. We need to have the sensation of good posture rather than me just telling you stand up straight. Yeah, don't lock your knees, stand up straight. That's not going to work, okay, because it's not a felt sense. Okay. Back spasms. So we talked about back spasms earlier. Many of us will experience back spasms. Okay, why do they happen? Because they can just randomly happen, can't they? So our muscles, yeah, lots of people raising their hands at that. Yeah, because why do they happen? Well, if we've got that unstable spine, the muscles will start to tense up. Remember we talked about the ligaments controlling the vertebra? The muscles around the spine will start to tense up in an attempt to stabilize the spine. Okay, so that alone, if I suddenly start using a lot of, and I feel this on my clients, I always have a tactile feel, and I can feel that the muscles in some parts of the spine are really, really high tone. So they're doing way too much work than they need to be upright. You know, what we want to try and do is find a way, ideally, to stand with the least amount of muscular effort. So how can I hold myself up with the least amount of muscular effort, okay, without the muscles overworking, okay? Other causes of back spasms, we might be using the wrong muscles to breathe, and that can increase muscle spasms. So if I'm a upper chest breather, and I'm up here, and I'm overusing my neck muscles to breathe, we call them accessory muscles, that can cause an upper back spasm. If you've ever had sort of a spasm in your rib cage somewhere, that could be the reason, okay? Poor body awareness leads us to using the wrong muscles. So this is why working on proprioception and body awareness and felt sense is really, really important, because we learn to use the right muscles instead of taking the path of least resistance. And coming back to that anxiety, fear of movement can contribute to spasm and tension. So if I'm scared of moving, I'm really worried about it because I might sublux or it might hurt, I'm going to be guarding. And if I'm guarding, I put more tension in my tissue. And then when I try and move, oh, yeah, that really hurts. Something's gone into spasm. Yeah, because muscles want to be able to glide. Yeah, the muscles are designed, all muscles want to do all day is expand and contract, expand and contract. That's all they do. They don't do anything else. So if we're holding ourselves in a contraction, when you try and expand, because I'm going to stretch and get something, oh, yeah, that hurts, because it's not been taught to expand. Okay, so we need to encourage, we need to move. And I understand that that's scary for many of us, but there are ways around that. And that's why, you know, we talk about breathing and relaxation very early on in movement therapy, in my movement therapy, because we're trying to calm the nervous system so we're not quite as scared of movement. So how do we change this picture of having spasms? So we need to train the stabilizing muscles to do their job. Okay, so that's the first thing. We need to learn good body mechanics. So things we talked about today: alignment, understanding this idea of letting the body move with expansion and contraction, understanding how the body moves, building body awareness. You know, that is such an important thing. And it's something that's, you know, enjoyable to do and, you know, easy to do. We can do that lying on the ground, just feeling the weight of our own body to start with. Because when you lie on the ground and you start to feel the weight of your own body, the fact that you feel heavy on the ground means that your muscles have already started to let go a little bit. So if you're someone who's very, very tight and you have a lot of back spasms, just allowing your tissue to soften and release is already going to improve things. Okay, but you need to be aware of it in the first place. So a lot of people that when I work with them, they lie on the ground and they go, oh, I didn't even realize that I was arching my back, or that my ribs were elevated, or that I wasn't breathing properly. And because it's just normal for us, we're not aware of it. So building body awareness is really important. Changing breathing patterns, so learning first to soften, but then learning diaphragmatic breathing, and slow, thoughtful movements to build confidence. So I don't know if you've seen any of my videos on YouTube, or you'll notice that my movements are very, very slow, because what we're trying to do is change the nervous system, change how you interpret movement. If we just rush through the movement, that's just like doing exercise, right? We're not going to change anything. And the problem is, if we start doing exercise, we're going to come on to exercise now. But if you start doing exercise and strengthening exercises because we've been told you need to build muscle tone, and you start doing as you're told, and you start lifting weights and whatever, you're training your muscles in the wrong place, because we haven't looked at alignment first. Okay, so you'll do the strengthening, you'll probably get stronger, but you're strengthening the wrong muscles. So we're not strengthening the stabilizing muscles, you're strengthening the big global muscles. And we need to get to the stabilizing muscles, which come into play when we're in the right place. So it's really important that we are very thoughtful and mindful with our movements. And that will also help build confidence, of course. And, you know, some of my clients, they do 1 or 2 reps of an exercise, and that's absolutely fine. We don't have to be doing 30 reps 3 times a day. Okay, remember, we don't like repetitive movements. So that can, again, cause irritation and pain. So that's our back spasms. So what do we have? So there's lots of options, obviously, for back pain, and some of them are going to work. We're all different, aren't we? So some things will work for some people. Love orthotics or taping. Some people, it doesn't work for them. So, you know, you've got braces, physical aids, orthotics, we've got painkillers, acupuncture. Some people find that very helpful. Diet, obviously changing diet can help. Taping, physiotherapy, awareness training like Alexander technique can be quite useful. Meditation and mindfulness, I'm a huge fan of, just because it does help calm the nervous system down. And I know that a lot of the pain is, you know, that is contributing to our pain. Fixing the breathing patterns, so maybe going to somebody who understands breathing. changing the nervous system response. That should be at the top, really, because that is so key to all of this. When I calmed my nervous system down, that was the first step to really getting pain-free. I don't have pain, I'm very thankful. And that's what I do now, is help people find that as well, so they don't have pain. And of course, I'm going to say a safe and appropriate exercise program, because I teach movement. So I'm always going to advocate introducing movement into any kind of solution. And, it doesn't even have to be an exercise program. It might be that you go for a walk around the block. You might walk your dog. You might, it doesn't have to be a formal exercise class. Okay, it just needs to be movement. Okay, so what is appropriate then? Appropriate exercise. So it gives us mobility. So we want to, start to move pain-free, obviously, but we want stability. Now, stability doesn't mean guarding and bracing, okay? Stability can mean something totally different. And by bracing there, I don't mean wearing a physical brace, I mean bracing the muscles, okay? So we need to learn how to have stability without doing that guarding, which puts more tension in the body. Desensitization by calming the nervous system down. We want strength. We do want strength at some point to support the body and the mind. And confidence, it's really important. Many of us will have tried movement, tried exercises, and maybe it hasn't worked out so well. Yeah, lots of us might have been to physiotherapy or an exercise class, and maybe, for whatever reason, we've ended up hurting ourselves or it not going so well. So yeah, lots of people, thank you, raising their hands at that, because it happens, right? Because for various reasons it can happen. So we need to build confidence and not have that fear surrounding movement. I think it's really important that the body and the mind feel safe. So if you feel safe in whatever you're doing, either working with someone who you trust, your nervous system is instantly going to calm down, because we know, unfortunately, many of us have had bad experiences with medical situations, medical professionals. Sometimes we don't feel that trust between us and the person we're working with. So feeling safe and supported is going to help with our pain management, and thinking of whole body connections. So you saw from the pictures how everything is connected to everything else. I don't really teach single body parts. I'm always trying to relate how the shoulder impacts the pelvis, or how the foot impacts the pelvis, because I want us to start thinking of a whole body rather than a disjointed body. And learning to use the correct muscles and not use the wrong muscles, obviously, is going to be a huge factor. Okay, so where should we start then? What should I do? I'm in pain. What can I do about it? So the first thing in sort of the approach I take is we start with breathing. Okay, so lying supine or sitting, if you can't lie down, but you can do this in a bed, of course, and learning to feel that sense of weightiness, letting go, just letting your body settle into the ground. If you've been holding tension in your back, just letting your body release. And that won't, I'm not saying that's easy. That can be really challenging, because if you've been holding tension for a long time, letting go is a big deal. Your brain's going, no, why should we let go? We need to hold on. So, that's not something that you can, maybe rush. You've got to take your time. Learning that the pelvic floor and the diaphragm work together. That hypertonic pelvic floor where we've been bracing. Learning proper diaphragmatic breathing will really help. And relaxation is proven. They've tested it. There's research. It does reduce pain signals. Okay, so we start to calm everything down. And we talked about alignment. We need to start really thinking about our alignment and how can we get closer to that skeleton picture without obviously fixing ourselves in that position. So that would be my first step, because we need to start calming things down and just taking time to actually start to build some body awareness. So once we know where our body is. So we spent some time, we start to feel, I can feel the weight of my body. I can gently move my arms. I can move my legs. When we have some sense of alignment, we can start working on our motor control, our proprioception, and our stability. Okay, so that comes after you've started to unwind some of the tension. Okay, and these are just some examples. Yeah, I'm not suggesting, you're able to do all of these or any of them, but I'm just saying these are some sort of proprioceptive examples. So top left, can I keep my back heavy and take my arms overhead without arching my back? Can I do a bridge? Doesn't have to be that high. Using bands and balls are very, very useful. So can I feel my foot in the band, and can I roll my my leg along the floor? Lying on my tummy, can I breathe on my tummy? Have I got awareness there? So lots of different ways, all low to the ground to start building proprioceptive and awareness and motor control. What about my core? Okay, so core stability. It is doubtful there exists a core group of trunk muscles that are recruited to operate independently of all other trunk muscles. That's from a research paper by a guy called Lederman in 2008, a very interesting paper called The Myth of Core Stability. So in this photograph, and those of you who might have done Pilates, this is called a single leg stretch. So I'm curled up, I'm pulling one leg in, I'm stretching the other leg out. I can tell you now that I am not bracing my core in order to do that exercise, because as we've learned, muscles need to glide and slide. Now, I'm not saying that we shouldn't have abdominal muscle activation or pelvic floor engagement, but I'm just saying that to have a healthy functioning body, there isn't a group of core muscles that work independently because they're all connected to everyone else. All of those muscles need to work together, and those muscles need to respond to whatever it is you're doing. So if I'm just lying on my back, lifting one leg up, I don't need to brace my core. Here, it's obviously a little bit more challenging. There's going to be more abdominal engagement, but it's not because I've preempted it and sucked in my core. Okay, so I've done a whole video on this. There was a video on YouTube called The Truth About Stability, where I talk about that paper and I look at the functionality of core stability training. Okay, so that's just my opinion. I've never taught core stability training. The people who come to me who have been taught core stability training are often in pain in their pelvis. And when we unwind the pelvis, their pain often disappears. So that's kind of enough evidence for me to tell me that bracing your pelvis is probably not a good thing for us to be doing. Okay, but again, that's just my opinion. Have a look at my video and see if you agree with me. So what about strength? We're told that we need to strengthen our tissue. And I've said here, don't be in a hurry, because before you start doing strength work, have you got tissue tolerance? Okay. Some lady commented on the Facebook post, this post picture in the bottom right of me pulling on a band. And they said, if I did that, I'd be in agony. Yes, that's absolutely probably yes, because that isn't an exercise we'd want to be doing straight away. This is further down the line when I've got awareness of my body. Yeah, I can use bands, I can use hand weights, I can do a quadruped and lift my leg. Yeah, because I've built my tissue tolerance. If I gave this to you to do on your first lesson with me, yes, your back would probably not be very happy because it's tight and it's tense and we have no awareness of where we are in space, and you'd be using the wrong muscles. So yes, I totally agree. You wouldn't be given this on day one. Yeah, you want to slow things down. We say go low, go slow. Okay. And I just wanted to share this with you. This is from Dr. Russick. She did a presentation to the Zebra Club. Just really interesting. So she says, don't stress other joints. So we might be exercising and they might be hurting us. If you look at this bridge here, the picture in the middle, you can see the arrows pointing up into the lumbar spine where it's being squashed in a bridge. This lady also shouldn't have a cushion under her head because she's going to hyperextend her neck. It's not very good. Holding bands can be very painful for people. And you can see this squatting position. Can you again see that curve in the lumbar spine? So remember, the body takes the path of least resistance. So here's a very mobile area for many of us. I'm going to squat and my back will collapse into that picture. Okay, so that's why understanding alignment, so that when I go to do a squat, I don't go into that posture and I don't hurt my back. Okay, so it's being aware of any exercises might have been given. Are we actually doing those properly as well? Okay. So very quickly, small steps. I know I've overrun. I'm very sorry. I've talked too much. Everything counts. Yeah. However small, doesn't matter. Progress, not perfection. Okay. So keeping the idea of moving forward, but not trying to be perfect. As long as it doesn't hurt and it doesn't increase your pain, then it doesn't matter. Okay. It's not about being perfect. We don't want to perform. Yeah, we're not performing an exercise. We're just trying to move our body without pain. But if we can move with awareness, I think we're going to have less pain. Self-awareness, self-belief, it's going to give us that confidence back. And pacing is essential. You know, don't feel pressured to go and do, 30 reps 3 times a day and exhaust yourself. Start with whatever suits your body that doesn't cause a flare up. If you're pushing and pushing and pushing and your body's not tissue tolerant, we're going to get a flare up. Yeah, those tissues are going to get irritable. So we don't want the boom and bust. Yeah, take it slow, work at your own pace. It's really the best way forward. And, believe that exercise or movement is good for the body and mind. There's research out there, we know it. But the approach to the exercise is going to be really important, isn't it? Whether I'm being mindful and I'm aware and I'm taking my time, or am I just doing exercise without being mindful of my alignment and all those things we talked about. So yeah, breath, relaxation, proprioception, stability, balance, posture. That's the order that I work in. Start slow, go low. And that is all of my slides. So thank you so much for sticking with me and watching. And I think we've got some time for some questions. So I'm going to stop sharing my screen. Just let me stop. There we go.
Thank you, Jeannie. Thank you. That's fantastic. There's been lots and lots of chat, lots of questions in the Q&A as well. So let's try to get through lots of positive feedback as well. So I know some people have joined, especially from the United States. There's been a bit of an issue with Zoom timings and GMT. So just to say to everybody again that we are recording, so you will be able to watch it back. So don't worry, we will. Hopefully you won't miss anything. So sorry about that. That's a Zoom issue, I'm afraid. Right. So let's try to get to some questions then. I've been monitoring the chat. There was, I know you did mention this, Jeannie, but there was quite a lot of information, quite a lot of chat around pelvic pain, pubic pain, etc.
Yeah.
And you did mention that in terms of alignment, but could that be linked to misalignment and something connected to the lower back?
You mean pelvic pain or pubic pain?
Well, either, both.
Yeah, so, well, you're going to have, what I found, a lot of that pubic pain, pubic symphysis pain, if that's what we're talking about, that's going to come down to that laxity as well. Yeah, so laxity around the ligaments that are at the front of the pelvis, that can cause a lot of pain. Yeah, if you're misaligned in your pelvis, it's a bit like we were talking about. If I'm always anteriorly tilted, so my pelvis is always tipped forward, those muscles are going to be disjointed like that as well, aren't they? So some are going to be pulling, others are not going to be doing much. So yeah, if you can work on getting your pelvis to the, in the upright position, it's going to help. So think of your pelvis as a triangle. If you've got your 2 bony parts at the front of your hips, which we can probably all touch, so your sort of front of your hip bone, and then you've got your pubic bone that comes down in a sort of a triangle. Now that triangle is always supposed to be facing forward. Okay, so if you're standing and your triangle's tipped forward, that could be putting more pressure on that pubis as well. Okay, so always getting ourselves into the best alignment is going to help. Okay, avoiding things like this goes the same for SI joint issues, avoiding any exercise or movements where you're separating the pelvis. For example, lying on your side doing leg lifts, sideline work, that's going to irritate any instability around the pubis or the SI joint. So I always keep pelvises in one piece. So make sure, do exercises where you're in one piece rather than doing big movements around those joints. Okay, hopefully that answers the question.
Thank you very much. Right, so I'm just trying to catch some of these. Somebody's asking, Rebecca has asked a question about hypermobile EDS and functional neurological disorder. Is there any data, any research linking the two things that you're aware of?
I'm not an expert really on FND, so I think there is research, there is some, but I'm not really an expert in it, so I wouldn't like to comment on that.
There's also quite a bit about sleep and people struggling with positioning for sleep. Now, we know that pain and sleep, if you're in pain, it's very hard to sleep.
Absolutely.
Specific questions about positioning for sleep and getting comfortable. Any advice? I know it's a very generic question.
Yeah, I mean, gosh, this is such a big issue, isn't it? I did do a video on YouTube about different types of pillows, if anyone's interested in that. But just from my feedback from sort of, obviously in the Zebra Club, I see a lot of feedback from people and discussions that go on in there. So there are lots of different solutions. Of the main thing people seem to have are lots of different sort of sausage type pillows, so they're supporting their joints. Lots of people have an array of different pillows, and they use lots of different supports. But yeah, different mattresses, of course. But yeah, I wish I had an answer, because I know it's such a huge issue for us. But think of some people I know support themselves all the way down their bodies to help prevent sort of subluxations and things when they're asleep. But yeah, it's such an individual thing as well. But no, I wish I had the magic answer for sleeping and supporting. I don't, unfortunately. But
okay, and then somebody has asked, is it really possible to be pain-free without pain medication?
Well, again, everyone's individual, and I can only speak from my personal experience. I don't take any pain medication. Okay, so I used to have chronic pain, but through my work, I've basically rehabbed myself. I don't take anything. Now, I'm not saying, as I say, I don't have all the answers, and I'm not saying we shouldn't be taking our pain medication if we need it. Of course not. Everyone is different. I've worked with so many clients who have been on very strong painkillers like morphine. We're talking sort of morphine level painkillers, and we have come off those painkillers. Okay. Again, I'm just thinking of individual cases. I'm not saying it's the same for everyone, but I would say for some, yes, we certainly can get the pain to a place that's more manageable. Okay, and some people, as I say, have come off all of their pain medications. Okay, but again, that's just my experience of that. And I'm not recommending anyone come off their pain medication without guidance or anything like that, obviously. The people who came off their pain medication did it under proper medical supervision. Yeah,
okay. And then Jessica has asked, how often and for how long should we be exercising?
Good question, very good question. Simple terms, little and often. So if you're just starting out, we would rather you did a little bit, 5 minutes regularly, maybe 3 or 4 times a week, because what we're talking about is building tissue tolerance. So if I went and did a big workout, I was feeling good one day and I thought I'll just go and do an hour. And then what happens is I'm not tolerant for it and I have a big flare up. So I don't do anything for 3 weeks. And then I kind of have to start again. But if I work under the baseline, as it were, and do little and often, 3-4 times a week, 5 minutes, and gradually increase my level of tolerance. Okay, so someone's just asked in the chat, can I define tissue tolerance? Yes. What I mean by tissue tolerance is we all have a baseline. So my tissue is quite tolerant, let's put it that way. So I can do pretty much whatever I want and I don't get a flare up. Okay, because over the years, I've toned my tissue. So tissue tolerance is muscle tone. What can I tolerate before I get a flare up? Okay, so if I'm new to it, when I first started, I didn't have any tissue tolerance, so everything hurt. Okay, and that's where a lot of people are starting. Everything hurts. So what can we do? One repetition that doesn't cause a flare up. Okay, so at the moment, maybe your tissue tolerance is 1 repetition, which is fine. Maybe in 2 weeks, you'll have done enough that you can do 2 reps. So your tissue tolerance has now improved because you can do 2 repetitions without pain, or sorry, without making your pain worse or without getting a flare up. So that's what I mean by tissue tolerance. We gradually build up your ability to do stuff. But if you said, right, I'm going to do 20 reps of whatever exercise, you wouldn't know what your tolerance level is because you started too high. Does that make sense? So if I start at 20 and I'm in agony the next day, how do I know it was the 20th rep that hurt me? Or was it the 10th rep that hurt me? Or was it the 2nd rep? So I need to figure that out. And all of us will be different because we've all got different tissue quality. Yes. So that's tissue tolerance. And as I say, start slow, go low. Okay. 3 times a week if you can, 5 minutes if that's doable for you. But the most important thing is listen to your body. Okay. Don't feel pressure to think, oh gosh, I've got to do this. And we want it to be enjoyable. Okay. You want to enjoy movement. You don't want to think this is a chore and I hate it. People are asking, Kay, what the Zebra Club is. Do you mind if I just mention?
No, I was actually going to suggest that you do that, please. That would be great. Thank you.
Yeah. So, thank you for asking. There's a few people asking. So the Zebra Club is, it's an app now that you can have on your phone or you can have on a desktop. You can get both for the same price. And it's got over 100 videos in it. So apart from having sort of the exercises we've been talking about today that are all categorized into different areas, apart from the exercises, which, are brilliant. Thank you. Someone's saying the Zebra Club is amazing. Thank you. What makes us so special is that we have a community that's part of that as well. So within the app, it's all private. Only members can see the chat. People can ask questions. I'm on the app every day answering questions like this. What do I do about this? What do I do about that? I'm there every day. We have meetings once a month just for members. We have guest speakers. It's a kind of a whole inbuilt community where you're going to get your movement, but you're also going to get that environmental support. Remember, we were talking about support. Do I feel supported? Do I have people I can talk about? Because, the one thing about this is that sometimes people can feel a bit isolated, can't they, when they're living with this condition. So there is a cost to it. I try and keep it low. So there's a monthly charge or an annual charge. And you can find that if you go to www.thezebra.club, it's got all the prices and it will tell you even more about it on there. Someone's saying they do their exercises in the shower in the Zebra Club. Oh, I hope you're safe in the shower doing that.
Jeannie, another question I spotted was about why do you recommend diaphragmatic breathing rather than abdominal breathing?
Yeah, well, I think that kind of comes under the same umbrella. Okay, so we want the diaphragm and, as I was talking about, the pelvic floor to work together. And obviously pelvic floor is going to impact your abdominals. Okay. So when you inhale, the diaphragm goes down. Okay. So the pressure forces the diaphragm down. It forces the pelvic floor down. So that's going to impact your abdominals. Yeah. Your belly. When you exhale, and this is just obviously happening naturally, the diaphragm lifts and it draws the pelvic floor up with it. Okay, so when the pelvic floor lifts up, it contracts, the muscles contract. Remember I said all muscles want to do all day is expand and contract. That's all they do. So everyone is now lifted up. Now when the pelvic floor lifts up, you're going to feel those lower abdominal muscles, your belly muscles contract as well. When you inhale, everyone stretches again, they expand, and then they contract and they expand. So we want that natural rhythm working. And so that diaphragmatic understanding that the impact of, basically you're talking about pressure inside the abdomen. That's what's causing this. So that's naturally going to contract your abdominal muscles. Okay, so it's kind of the same thing. Okay, what we don't want is upper chest and shoulders going up and down. Yes, so we want to get lower. But the problem I found, it's not a problem, but a solution I've seen, people were often taught, like you say, to do belly breathing. People always say you need to do belly breathing. The problem we have with that is that so many of us have been like this for most of our life. So we breathe here and this is stuck, like the ribs are stuck, they don't move. Try and do belly breathing when you're holding yourself like this. It's incredibly challenging and painful because everything feels tight and people feel like they can't get breath in. So what we do first is teach people to actually relax and let go of the thorax. And then we start doing the belly breathing. So you can't just start, most people can't just start with belly breathing. They have to relax the thorax first because it's really difficult when you're tight and tense. Okay. So yeah, it's one of the hardest things actually, learning how to breathe again, breathe properly. I found I had to go through it. It was really challenging. So don't give up practicing on it.
Thanks, Jeannie. So I think I'm going to take a couple more questions.
Yep.
Someone has asked about the relationship between hypermobility and arthritis and the impact on pain and exercise.
Oh gosh,
that's a big one, isn't it?
That's a big one. Yeah, so obviously arthritis is an inflammatory condition as well. So yes, of course you can have hypermobility and arthritis. So yes, I'm not an expert on arthritis, to be fair, but yeah, it's an inflammatory process. So you're going to have more inflammation around those joints. And then if you've got the laxity as well, you've got the laxity around the joints as well. So yes, I have, it doesn't preclude us from doing movement. In fact, if you have arthritis, we do want to do movement because it's important. The less we move, the stiffer we're going to become, the more painful it's going to become. So yes, we might have to modify things. We might have to do things slightly differently, avoid certain things depending on where the arthritis is, but it's still a very good thing to be doing. Yeah.
Great, thank you. And there's been a few questions on this. Again, I know it's a hugely broad topic, but is there something you can say about the impact of the menopause on pain?
Oh, yes. Well,
we could have a session on that, couldn't we? I think
we could. Yes. Well, yes. Being part of the menopause club myself at the moment, yes, I have personal experience of it as well as obviously working with my clients. So we do know that obviously hormones, female hormones impact our symptoms. So puberty, pregnancy, menopause do have an impact on pain and symptoms. Unfortunately, we don't know enough about it yet, but we do know that there's an impact. So yes, things change in the menopause. Hormones are raging. You're going to start, I'm not going to say you're going, some people start getting all sorts of other issues like recurrent bladder infections, migraines, those headaches. So yes, there is, unfortunately, it seems to impact people quite a bit. But again, certainly doesn't want us to stop moving. So if we're going through the menopause, we've got to, I found the relaxation and the breathing were even more important now because my hormones are like, and I need to calm everything down. But yes, we still need to start. Someone's saying that their symptoms improved. I do know people who say they improved during pregnancy, but someone's saying during menopause. Well, that's interesting. I've not heard that before because myself and most people I see, symptoms have got worse, but that's interesting that somebody's found it improved. And that just goes to show, doesn't it? We're all so different. Yeah, it
does. And then earlier on in the chat, there was a bit of discussion about the role of insoles and orthotics and how that can help alignment. Is there anything you can say about that?
Yes, so so we saw that diagram, didn't we, of the skeleton with the pronated foot and how that kind of twisted the whole spine. So yes, some people, I mean, flat feet or pronated feet, we have a lot of foot issues in our community, okay? It's very, you know, the laxity in those joints is what's causing, and gravity, there you go, gravity and laxity again, is causing that pronation of the feet, the flat feet, okay? So a lot of people have an awful lot of pain walking. It's very painful. So a lot of people do need orthotics, okay? And there's nothing wrong with that. We had a podiatrist actually come and talk to the Zebra Club just last week or 2 weeks ago. Had a very interesting presentation about all the different options available to a hypermobile foot. It seems that soft insoles seem to be more beneficial than hard ones for hypermobile feet. We don't like, again, I think it's because we don't like being fixed in a certain position. Yeah, it's just going to irritate things. So yeah, nothing wrong with it. But what I would say, because as I say, some people put the orthotics on and their pain can just disappear like that. It's like, wow. And they feel muscles working that they've never felt before because everything's in the right place. And they go, oh, my glutes are working. Yeah, it's really remarkable. But what I would say, if you are wearing orthotics, make sure you're doing exercises, foot type exercises, lower leg exercises as well. So don't just rely on the orthotic, and because we want to work the foot at the same time. Yeah, it's a bit like we're being on crutches. You wouldn't want to be on crutches forever because things are going to decondition. So wear your orthotics, but also do foot strengthening exercises, okay? Because with tone, this was my foot and it's totally collapsed. Some people are able to redevelop the arches in their foot, yeah, and build tone in their feet, okay? I'm not saying that's for everyone, but some people can see changes in their feet, okay?
Great, thank you very much.